Bois.
A nutritious diet is important at all ages, but the earlier children learn to eat good, healthy food, the more likely they are to carry those habits into adulthood. Access talked with Providers Choice CEO Gail Birch about her company's efforts to help child care providers prepare healthy meal options. Gail Birch is the CEO of Providers Choice. Gail, welcome to Access Minnesota.
Thank you, Jim.
Providers Choice works with the U.S. Department of Agriculture and with child care providers in Minnesota. What exactly does it do, and what kinds of services do you provide?
Well, as you said, we administer the Child and Adult Care Food Program, which is a program created by the USDA. And what that program does is we provide subsidies to licensed family child care providers, centers, and after-school programs that serve nutritious meals to children. Here in the state of Minnesota, it then comes through and is administered by the Minnesota Department of Education.
In your experience, why do daycares choose Providers Choice? Is it difficult for child care providers to get healthy foods on their own?
I don't believe that it's difficult for providers to get healthy foods on their own. I believe that child care providers are faced with the same challenges that you and I are faced with. We're all busy. We want quick and easy meals. We have a tendency to select the foods that we prefer sometimes, which are oftentimes less healthy for us than they should be. And quite frankly, I think oftentimes the children, the foods that they like are often the foods that aren't quite as healthy as they should be. So what we do at Providers Choice is find ways to help those providers cope with those challenges. And we do that by giving them an opportunity to talk, discuss, have dialogue about nutrition education and the importance of it for preschool children. We also provide them with the tools to provide healthy meals. We provide them with quick and easy recipes that are healthier alternatives to the processed foods that they could possibly be serving those children. You know, research has shown that in, I think it was 2006, Minnesota was rated the #1 healthiest state in the nation. In 2008, we dropped down to 4th place. Since 1999, the prevalence of obesity in the state of Minnesota has increased by 155%.
You can help providers prepare healthy meals. You can provide them with menus. How do you motivate the kids to eat foods that they might not like? Say they don't like vegetables. How do you get them to understand the importance of eating healthy when you're in preschool?
I think that, I think our goal, everybody's goal, is to create lifelong healthy eating habits, not making sure that they get that broccoli in them at this particular meal. There's a woman by the name of Ellen Satter. Ellen is a registered dietitian and a social worker, and she's done some research she did a number of years ago where she actually taped meal times between parents and caregivers and children and observed the children's behavior to determine what helped the children become healthy eaters. And what she determined as a result of that research was what is referred to as the feeding relationship or the division of responsibility. And what that means is, it is the adult's role, be it the caregiver or the parent, it is our job to decide what nutritious foods we're serving those children and when to serve those foods. So in other words, we set the meal times. The children aren't just grabbing something and running around the house with it. So the adult's role is to choose the right foods for the children and decide when to serve them. The child's role is then to sit down and choose what of those healthy foods they're going to eat and how much of it. And this has become known as the feeding relationship or division of responsibility, and has become known as best practices when you are determining quality child care. Because again, the research proves that by allowing the children to make choices about what foods they're going to eat and try, and how much of that food they're going to eat and try, they learn to regulate and be in control of their own eating. And if you start that at a very early age, it definitely leads to lifelong healthy eating habits.
Providers Choice obviously provides menus and guidance for preparing healthy meals for children. Do you also provide guidance to daycare providers about activities, keeping kids active, moving around, burning up energy?
Absolutely. We started providing activities for children being active to providers years ago, simply because we are very much aware that to have a well-rounded child, that child also has to be physically active. It's not about becoming a star athlete. It's about being able to enjoy being active for the rest of your life. So we often prepare booklets that contain physical activities for the providers. And this particular year, we're going to be focusing on, we find that providers like to have a theme. So we've got a ball that they're going to be provided with, an inflatable ball. And then we've got activities that the providers can do with their infants, their toddlers, their preschoolers, and their school agers, both inside and outside. Children at this age need adults to help them get involved in these physical activities. Yes, they need to be out there running and playing just like we did when we were growing up. However, there's less opportunity for that now than there was when I was growing up. So we do need to make sure that we provide those times and that opportunity for those children to be physically active. And we try to make it easier on the provider by having those ideas easily accessible to them.
There's been some discussion in the news recently about First Lady Michelle Obama's initiative to improve the nutritional quality of food in public schools. Some parents and even some school districts are saying, wait a minute, if our kids want to eat pizza, the government isn't going to tell us not to do that. Do you have to deal with this kind of politics in what you're doing with Provider's Choice as well?
Well, I would start by saying that I understand the controversy. You know, we live in the United States, we are a free country, and most of us don't want someone legislating what we can and cannot eat. I think the intent of what she was trying to accomplish was to encourage more healthy foods being available to our children, and I think that's something that we all want. With regard to what we deal with at Provider's Choice as a participation with the Child Care Food Program, is there's constantly new rules and regulations that we have to follow. And some of those rules and regulations have sometimes been frustrating for us. But most of the time, in my experience over the 25 years of doing this program, they have benefited not only the provider, not only the children, but ensuring that this program lasts a long time.
Gail Birch, CEO of Provider's Choice, thanks so much for joining us on Access Minnesota.
Thanks, Jim.